the periosteum. The periosteum is nothing but a thicker outer covering of the bone that provides nutrition to the bone.
Because children are growing at all times and so are the bones, and that's quite different. And as you mentioned, that the periosteum is quite thick, which is also a distinct feature from the adult bone as well. Now,
The growth plates are the weakest zones of the bones, which means what? That the fractures mostly occur through growth plate in children.
hi there, I'm Dr. Owais Rafiq, and welcome to Growing Stronger Together. Today, I have with me a children bone expert, Dr. Sadaf.
Thank you, Dr. Owais. It's my pleasure to be here. Thanks for the invite.
Great! To start, people often think kids' bones are just mini versions of adult bone. Is that a true statement?
I would rather consider this to be a false statement because there are significant differences between the architecture of kids' bones and adult bones.
Okay.
Well, to begin with, the basic difference is that when children are born, their bones are dense and porous. But
Okay.
as they grow and their activity becomes more, the bone becomes denser. How does this bone becomes denser? It becomes denser by taking it more bone tissues and becoming more skeleton-like rather than cartilaginous-like. Another significant difference is the periosteum. The periosteum is nothing but a thicker outer covering of the bone that provides nutrition to the bone. This,
Okay.
as we talk on later, I would tell you what is the significance of a thicker periosteum.
Okay,
Also,
I see.
another difference that's to be noted is the presence of growth plates and epiphyses, which are very important in increasing the length of the bones.
That's very interesting, Dr. Sadaf, because children are growing at all times and so are the bones, and that's quite different. And as you mentioned, that the periosteum is quite thick, which is also a distinct feature from the adult bone as well. Now, how does all of this affect the kids when they get hurt?
These specific features, they provide variable patterns, and these patterns are usually not seen in a skeletally mature bone.
Okay.
Yeah. To begin with, like I said, the periosteum, it's more robust, more thicker, provides extra stability in case of any fractures.
Oh, okay.
Also, another point to be noted is that the bones of the kids are more elastic, which means what? That they absorb more energy and bend to a greater extent before breaking.
Okay.
The periosteum, it has an upside, it has a downside. What's the downside? It might block reduction in certain cases
Okay.
and might hinder the bone from coming back to its place.
So it could act negatively in those children, for example, who kind of get hurt and have a fracture, and you're trying to fix it, and then it would, the periosteum, the thick periosteum, although it protects it and makes it more elastic, but it could also at the same time make it more difficult for you guys to fix the bone.
Absolutely. But periosteum is very important. It is required for providing extra stability, which means that that's the reason you don't go and fix most of the fractures surgically.
Wow, that's some great information that I'm learning today.
Also, another important thing that's to be noted is the presence of growth plates. Like I previously mentioned, the growth plates are the weakest zones of the bones, which means what? That the fractures mostly occur through growth plate in children.
Okay.
Another feature that was mentioned before is the epiphyses.
Yes.
Epiphyses can be a location of pain, specifically when there is chronic irritation of a tendon that is overlying the epiphysis.
Now, children fall all the time. Are there any unique fractures that are found in kids?
Well, I must say, they are not kids if they are not playing and falling.
True, absolutely. So much energy that they have.
Yeah, they inspire us,
Truly.
don't they? Thank you. Talking about unique fracture patterns, yes. As I mentioned previously, that the pediatric bones are more elastic, which means that they absorb more energy and they bend rather than breaking, which means
Okay.
what? That there are certain unique fracture patterns that we don't see in skeletally mature bones. For example, buccal fractures. They happen
Okay.
when the bone is compressed.
Okay.
Green stick fractures, plastic deformations. They occur when the bone, instead of breaking, bends to one side.
Wow, that's interesting. So you don't have a break in the bone, but instead you have the bone bent at an angle that is more than the normal angle that's supposed to be. And does it cause any limitation of function as well when it's bent to that certain extent?
Yes, it's considered as a fracture
Okay.
because occasionally, let's say in a green stick fracture,
You mentioned growth plate. Now, what happens if those growth plates get hurt?
let me first explain to the viewers what a growth plate actually is.
Yes.
Growth plates are nothing but the area of the bone from where the bone grows taller because growth plates are responsible for adding more bone tissue to the bone itself.
I see.
Well, it's a relatively weaker zone.
Okay.
That's why it gets fractured easily. And it creates specific patterns which are called as physial injuries.
Now, you mentioned physial injuries. What are these physial injuries?
Growth plate injuries are unique. They need to be brought back to their place absolutely, which means that they need absolute reduction.
Okay.
Also, growth plate injuries have a predisposition of causing temporary or permanent growth disturbances.
Now, Dr. Sadaf, when the bone breaks or bends in children and you try to bring it back to its place, it's called reduction. But you mentioned the term absolute reduction. Uh, how is that different to an adult fracture, and what do you mean by absolute reduction?
Here is another key difference between the pediatric bone and the adult bone.
Okay,
The children bones, they're constantly changing, they're
I see.
constantly growing.
Absolutely
So
right.
they have a unique ability of what we call as remodeling.
Wow.
This brings me back to my previous answer of absolute reduction and relative reduction. Most of the time, in children, we do not require absolute reduction.
Okay.
Because of the remodeling potential, we do not necessarily need to bring the bone back to its place 100%.
Wow.
Every bone has a specific tolerance limit.
Okay.
By tolerance, we mean that there is an acceptable angulation for each bone that can be left and it will lead to no functional disability. Let me explain this more clearly to the viewers.
Please.
Yeah. Which means that if you have a broken bone, like let's
Yes.
say, if you have an angulation that is this much, you don't have to bring it back here like a scale. It doesn't have to be straight.
Okay.
Depending upon what's the tolerance for this particular bone, for example, let's say the tolerance is this much.
Okay.
So from here, you can just bring the bone till here.
And that's how you reduce
Yeah,
it.
rather than bringing it completely and aligning it like a scale. Because the tolerance is this much, you can bring the bone from this position to this position and it will heal and remodel very well without any functional disability to the child.
Wow, and this is quite different from an adult because in an adult you need to align it completely straight, otherwise there would be some sort of functional disability, right?
Absolutely correct. The reason for this is that you can argue with me, instead of this, you've kept my child's bone like this.
Yes.
Definitely it's angulated, and how can you say that this will not affect the function? It will go from here to this position in 1 to 2 years because of remodeling capacity.
Wow, that's something new that I learned today, that children have a great remodeling capacity and sadly adults don't.
That's the beauty of nature.
Wait a minute. Does that mean that most of the children can get away with having a cast rather than having screws or nails in their bone?
You got that right.
That's the reason I always, whenever I see the orthopedic surgeons in the theater with a child, they're mostly putting cast. Is that correct, right?
Yeah. I would rather say 80% of the fractures in children can be treated efficiently and properly with an appropriate fitted cast.
Now, how do you make sure that the cast is the appropriate size and is right for the kid?
We have our own secrets.
Wow.
No, there's a technical term which is called as a cast index.
Okay, this is the first time I've heard this term, cast index, yes.
There is a calculation to it. I will not go
Okay.
into details,
All
but
right.
yeah, to make things simple, cast should be cylindrical, not circle.
Yeah, I never knew that. I thought it was always in circles rather than cylindrical, and it has to look cylindrical.
It has to, because it has to be appropriately molded so that it can hold the fracture. Shouldn't be very loose, shouldn't be very tight.
Wow. Well, it's safe to hear that you have parameters and measurements that you do to make sure that the cast is appropriate.
We keep a check on ourselves.
Now, Dr. Sadaf, although children remodel very well, can there be functional disability in children as well?
Yes, there's always a chance.
Okay.
Specifically, if the fractures were not brought between the tolerance limit of the bone.
I see.
The remodeling potential also depends upon the age of the patient.
Okay.
So the younger the child, the better is the remodeling, and there are certain more degrees that you can foresee. Also, the growth plate injuries are the ones that mostly cause functional disability.
Okay, specifically growth plate injuries.
And that too, in case if a part of the growth plate was affected rather than the whole of it. That would lead to angulation of that particular bone.
Okay.
But I don't want the parents to be anxious, because there are ways that we can deal. Absolutely. And there are very small procedures that can help us with that.
Now, Dr. Sadaf, vitamin D deficiency is quite common in adults and children. Does it affect the bone somehow?
It does. You'll be surprised to know that if you have a low vitamin D, it predisposes you to fractures with lesser energy.
Wow, I didn't know that. And how common is it, vitamin D deficiency?
It's pretty common.
In children as well?
It is. If you take 100 kids and you do vitamin D, 80% of them will have low vitamin D.
Whoa.
It's not only this. Vitamin D not only predisposes to fractures, but it also delays fracture healing.
Okay.
Yeah. So it's always a good idea that if a kid has a fracture, to give him vitamin D and calcium supplements, and to improve the nutrition, to include such elements in the diet like fish, like milk, like egg, like cheese, that would promote vitamin D.
And parents, please take your children out in the sun and have a play with them. Go and have fun with them. Put the sunscreen on, but it's so important for them to get that vitamin D absorbed through the skin. And also diet. I always talk about diet and nutrition. Please have them eat a lot of fish, meat, and
Eggs.
eggs. To wrap up, thank you so much, Dr. Sadaf, for being here today.
It was my pleasure. I had a great time.
Any last thoughts you would like to share with our community out there?
Yeah, as for the parents, I would like to inform them that pediatric fractures do not lead to functional disability in majority of the cases. And also it's important to know that each fracture pattern is different
Okay.
and requires an individualized treatment plan.
So, parents, let your child run around, have fun, let them play. It's okay if they fall. Most of the time, fractures in children don't need a surgery, and 80% of the time, it can be treated with cast. Till then, guiding health
Changing lives,
one heart at a time. And to all of our viewers out there, if you found this information helpful, don't forget to like, subscribe, and share this video with others who might benefit. And for more valuable insights and resources, visit our website at drowaisrafiq.com, and let's keep growing stronger together. Pain is common in many injuries and illnesses in children. Before we talk about these two most commonly used pain medications,